Welcome to the Introduction to Public Health module. This module provides you with an overview of public health as it relates to the U.S. healthcare system. If you need to exit before completion, you can come back and resume where you left off. However, you won't receive credit until you finish the entire module. After successfully completing this module, you'll have the tools to describe the purpose of public health, define key terms used in public health practice, discuss relevant events in public health history, state the core areas of public health, explain social determinants of health, and describe how public health differs from healthcare practice. Click the arrow on the right to begin exploring the world of public health practice. So, what is public health? Public health is the science of preventing disease, prolonging life, and improving the health of people and the communities in which they live. This is achieved by conducting research to detect, prevent, and respond to disease, identifying ways to prevent injuries, and by promoting healthy lifestyles. Public health efforts can be aimed at populations as small as a local neighborhood, or as big as an entire country or region of the world. Public health has made a significant impact on the health of populations over time. In the United States, from 1900 to 1999, the average life expectancy increased by over 30 years. 25 of the years gained can be attributed to public health interventions. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. It's important to mention that this definition of health forces us to examine factors beyond the physical aspects of health. We should understand that the mental and social aspects of health are just as important. Mental health is how we think, act, and feel. Social health is heavily influenced by an individual's gender, social class, race or ethnicity, and household size. There are three core areas of public health: protection, promotion, and prevention. All three areas aim to improve health outcomes of populations. The first, protection, focuses on the control of infectious disease, the management of environmental hazards, the maintenance of healthy workplaces, and the management of health emergencies. Promotion focuses on efforts leading to healthier lifestyle choices and behaviors. It could involve educating the public about the importance of physical fitness, or hosting cooking workshops to share healthy meal alternatives. Prevention is the third core area of public health. Its primary focus is to identify ways to avoid health issues before they occur. In many cases, this involves the administration of vaccinations and health screenings for early detection of disease. Each core area is supported by a solid system of support, adherence, advocacy, and information sharing among professionals in the industry. Let's assess your knowledge to see what you've learned so far. Certain factors determine a person's health status at any given time. In public health, these factors are known as social determinants of health. In 2019, the average life expectancy in the United States was 78 years old. This number could easily shift based on the factors or determinants that influence one's health. These factors include who you are. This is tied to an individual's age, gender, or genetic makeup. Family history plays a major role in health outcomes. What you do. This is described as one's lifestyle or health behaviors. Activities like smoking, alcohol use, eating habits, and level of physical activity can be used as indicators of health status. Finally, the conditions you were born, live, and work in are social determinants of health. You may have heard these conditions described as social or environmental characteristics. Ultimately, they directly influence your access to health insurance and quality care. as income and level of education can create a clear divide when it comes to the equal distribution of health resources. Meet Lyric, a 9-year-old African-American girl. Lyric lives in an urban area. She doesn't have any parks or playgrounds close to her apartment building, so she doesn't get enough daily physical activity. Lyric rides the bus back and forth to school, and her grandmother takes care of her after school. Typically, Lyric watches 4 hours of TV a day. Now, let's picture an intervention that can change Lyric's determinants of health. A group of parents work with the school and local recreation center to keep the gym open beyond school hours during the week and on school holidays. This provides Lyric and local community members with a safe place to exercise and play. Now, Lyric's grandmother can meet her at the gym after school, and their level of physical activity increases. Lyric gets a few extra hours to run and play with her friends, and her grandmother is able to walk the track while watching them play. Let's look at another example. Meet Charles, a 70-year-old Caucasian man. Charles retired a few years ago and is living on a fixed income in a low-income neighborhood. He's surrounded by convenience stores and fast food restaurants, and would have to take the bus to get to the closest grocery store. Diabetes runs in his family, and he was recently diagnosed with type 2 diabetes. What type of public health intervention could benefit Charles? You guessed it. Increased access to fresh, affordable fruits and vegetables. The local health department partnered with a local farmer to bring a subsidized farmer's market within walking distance to Charles' home each week. He's now eating less high-sodium canned food and eating more fresh fruits and vegetables now that he can afford them. It's now time to take a look at how public health differs from healthcare. You'll also be introduced to a few examples of public health in action. So, how does public health differ from healthcare? Let's start with healthcare. Think back to the last time you visited your doctor's office. During that visit, your doctor was focused on you as an individual, with the goal to diagnose and treat based on the reason for your visit. Ultimately, it was a one-on-one interaction. Public health is the study of populations, groups of people, communities. Its focus is on the prevention of illness and injury before they happen. This is achieved through research, surveillance, and response. Let's dive into some real-world examples of each. Public health professionals are responsible for improving health outcomes related to access to the healthcare system and the quality of care available across populations. While a healthcare worker is responsible for providing direct patient care, the public health system is working to ensure those services are both affordable and accessible. A research study published in the New England Journal of Medicine showed that in the early 1980s, there were about 250,000 patient transfers a year from private hospitals to public or Veterans Health Administration hospitals. Just under 90% of the patients studied were transferred for economic reasons or inability to pay, and 24% were deemed clinically unstable at the time of transfer. Clinically unstable patients have vital signs at abnormal limits, i.e. body temperature, blood pressure, pulse, and breathing rate. The research reported that some patients arrived with gunshot wounds or showing signs of heart attack or stroke, while others were pregnant and in labor. Their mortality rate, or number of deaths, for this population of patients was triple that of other patients. This research resulted in a public health intervention in the form of policy change and legislation. The Emergency Medical Treatment and Labor Act, commonly referred to as EMTALA, is a lesser-known federal law that was enacted by Congress in 1986 as a result of this research. It requires Medicare participating hospitals to screen patients for emergency medical conditions and provide stabilizing treatment regardless of their ability to pay. Referred to as the anti-dumping law, it was designed to prevent hospitals from transferring uninsured or Medicaid patients to public hospitals without, at a minimum, providing a medical screening examination to ensure they were stable for transfer. The push for EMTALA stemmed from an epidemic or widespread occurrence of patient transfers that were widely seen as inappropriate and dangerous for patients. Facilities that fail to comply with this legislation face major fines and penalties that could affect their eligibility for funding in the Medicare program. Surveillance activities provide information to guide public health interventions. It involves regular, ongoing reporting of diseases and conditions by all health facilities in a given territory. An active surveillance system involves visiting health facilities and reviewing healthcare providers and medical records to identify a specific disease or condition. Let's look at a few examples of public health surveillance initiatives. Polio was a common and highly feared disease in the 1950s. It caused severe illness, including paralysis, and even death among thousands of people. Public health surveillance activities identified more than 35,000 cases of polio in the United States, and over 15,000 infected people who became paralyzed after contracting the disease. By 1963, the virus had spread to more than 125 countries. A vaccine was introduced in 1955, and by 1979, the U.S. was free of new cases of polio. Public health response activities involve strategic, planned reactions to issues that have adverse effects on population health. Mothers Against Drunk Driving, or MADD, is a familiar example of a public health response in action. On May 3, 1980, 13-year-old softball all-star Carrie Lightner was struck and killed by a drunk driver while walking to a church carnival with a friend. Her mother, Candy Lightner, ignited a fire that led to a call to action. Nearly 25,000 people were killed in the United States in alcohol-related car crashes. This represented about 50% of all traffic deaths. The immediate public health response to this involved figuring out how and why these traffic deaths were occurring in the first place, so that actions can be taken to prevent them from happening again. Although public health aims to prevent disease, prolong life, and improve health, through research, surveillance, and response, it also involves the implementation of policies that support these efforts across populations. Between 2002 and 2004, reports suggested that cigarette smoking in the United States resulted in an annual health-related economic loss of $193 billion. The Clean Indoor Air Act was passed in 2004, banning smoking in the workplace and other public places. This encouraged smokers to quit, while protecting non-smokers from the effects of secondhand smoke. Obesity has recently resulted in a rise in awareness and intervention efforts, as more than 1/3 of U.S. adults and approximately 17% of children and adolescents ages 2 to 19 years are classified as obese. This condition involves the presence of excessive body fat that increases the risk of chronic, long-term health problems. Recent regulations include requiring food labeling specific to fat, sugar, and salt content. Additionally, funding has been given to programs that promote physical activity in schools, workplaces, and neighborhoods,